Now, the topic I share today is the therapeutic option of the ERCP EUS and PTCD in the biliary and the pancreatic stenosis. The first, what's the relationship between the three techniques? They're independent? The answer is no. They're independent of each other and also interrelated. What's the effect of the treatment sequence of the EUS and the ERCP? If do EUS first, EUS scan can provide additional information, and those information can guide the follow-up ERCP treatment steps. If the patient does not have the ERCP indication, EUS can avoid unnecessary ERCP. If do ERCP first, the ERCP process can provide some further detail, and EUS can be used to detect the locus lesion and then do EUS-FNA. Further, the cytological and pathological examination are carried out that give more further detail. When ERCP intubation failed, the EUS-BD and EUS-PD can be performed. Now, let's begin the first part. This article published in 2017, the figure shows the treatment process of difficult duodenal-papular cannulation. We're all familiar with these techniques and the process. How to improve the cannulation rates? The tips include angiography before the cannulation, pancreatic duct occupation with guide wire or stem, a pre-cut with a needle knife, just professionally in the lecture. Then, EUS assisted renovers or EUS RV technique is also a useful method. This paper, published in 2015, according to this article, success rate of the duodenal-papular cannulation is very high, nearly 100%. But we see the detail. The 7 patients underwent the EUS-BD or PTCD. The 3 patients treated with the EUS-BD had a distal CBD stenosis. The other 4 patients who received PTCD therapy were caused by the post-operative gastrointestinal changes and or a complicated condition. These 2 articles reviewed several papers. According to those data, the technical and clinical success rate were more than 90%. The total complication rate was about 20%. That shows EUS-BD is a good technique. And this article was endoscopic ultrasonography guide biliary drainage. Who, when, which, and how. Pay attention to this article. The author put forward the view that EUS-BD should be the first-line treatment for the biliary drainage. This article was about how to choose the EUS-BD and the PTCD after ERCP failure. From the data of this article, both EUS-BD or PTCD had a similar clinical success and complication rate. Also, conclusion is that EUS-BD can be effective and safe minimally invasive procedure alternative to PTCD. This article reviews 6 papers that are how to choose EUS-BD or PTCD after ERCP failure. According to the data at the figure showed in the PPT, both 2 techniques had a similar technical and clinical success rate. The total adverse event rate is also similar. The conclusion is that EUS-BD is effective alternative procedure, and EUS-BD may be replaced PTCD as a standard procedure of choice in case of failed ERCP intubation.